just as with public transport, children under 11 and those with certain disabilities will be exempt. The liability for wearing a face covering lies with the individual. Should an individual without an exemption refuse to wear a face covering, a shop can refuse them entry and can call the police if people refuse to comply. The police have formal enforcement powers and can issue a fine. This is in line with how shops would normally manage their customers. And enforcement is, of course, a last resort, and we fully expect the public to comply with these rules as they've done throughout the pandemic. I want to give this message to everyone who has been making vital changes to their daily lives for the greater good. Wearing a face covering does not mean that we can ignore the other measures that have been so important in slowing the spread of this virus. Washing your hands, following the rules on social distancing. And just as the British people have acted so selflessly throughout this pandemic, I have no doubt they will rise to this once more. Mr. Deputy Speaker, as a nation, we've made huge strides in getting this virus, which has brought grief to so many, under control. We are not out of the woods yet, so let us all do our utmost to keep this virus cornered and enjoy summer safely. And I commend this statement to the House.
Jonathan Ashworth.
Grateful, Mr. Deputy Speaker, and I thank the right honourable gentleman for his statement. After days of ministerial muddle, we finally have a decision. I've long warned that this virus exploits ambiguity and that mixed messaging in a pandemic is so damaging. On Friday, we had the Prime Minister saying he favoured face masks. On Sunday, we had the Chancellor of the Duchy of Lancaster saying he didn't favour face masks. Yesterday, the Justice Secretary, unsure what to say, had to say, in the end, he was perhaps in favour of face masks. It didn't have to be this way. We didn't have to have this confusion. We've long known about airborne transmission via aerosols. He's long warned about asymptomatic transmission. The Royal Society, the World Health Organization, has long recommended wearing face masks. Even Donald Trump now wears a face mask, although admittedly it's because someone told him he looks like the Lone Ranger, Mr. Deputy Speaker. The chair of the Health Select Committee, his predecessor, has long warned about wearing a face mask, and his own advice, published on the 11th of May, advised in favour of wearing face masks. So why has it taken 2 months for him to make this advice mandatory? And why will it take another 11 days for the measure to come in? The World Health Organization has said throughout this pandemic, act with speed, but yet again, this government appears to be in the slow lane. All we need and want is clarity. So can we also have clarity in other areas? What now is the position on workers returning to offices? Does the government want them to return to offices, yes or no? And can he offer greater clarity to the people of Leicester, now in the 17th week of lockdown in my city? Can he tell us what metrics will be used to judge whether Leicester can ease out of lockdown later this week? When will he make that decision? And how will he communicate that decision to the people of Leicester? And can he clarify why the Business Minister, the Honourable Member for Stratford, has ruled out extra support for Leicester businesses and employers, contradicting the indications that he gave to the people of Leicester? When people are worried about their jobs, this mixed messaging is the last thing they need. And of the other areas that have been identified for concern, the other parts of the country, will he instruct the Health and Safety Executive to inspect all factories, all meatpacking plants, all distribution centres and all large employment sites as a matter of urgency? On testing, local authorities still need specific data that can facilitate action. They still need, he disagrees, they still need person-identifiable data, not just postcodes. They need not just positive test results, but they need the negative results as well, so they can understand the overall infection prevalence. And they need contact tracing data, so they know who has been asked to isolate by test and trace, so they can follow them up. And they need it daily. The virus doesn't wait a week, so why should local directors of public health have to wait a week? I notice in the financial statement that £10 billion has been allocated to test and trace. Can he itemise what that £10 billion has been spent on? And can he rule out spending more on private outsourced companies and invest more in NHS labs and testing instead? Finally, Mr Deputy Speaker, today we have a report from the Academy of Medical Sciences warning of a new wave of infection this winter. SAGE has also warned that the transmission of the virus, quote, could be elevated under UK winter conditions. Yet missing from last week's financial statement was any increase in NHS England's revenue budget. Instead, we have a mooted NHS reorganisation with suggestions that Public Health England could be abolished, speculation that a new Centre for Disease Control set up in its place instead. But NHS staff need certainty now more than ever. So will he ensure the NHS and the social care sector gets the winter funding it needs to prepare for a second wave? People want to do the right thing. Muddled messaging hinders that. As George Osborne said yesterday, people just want answers. Can he give our constituents answers today?